Hey, Dr. Alex Tauberg here. Let's talk about x-rays for a second. One of the most common questions that I get asked on the phone is, do you take x-rays on the first visit? Well, the thing is, x-rays for the vast majority of patients or the vast majority of people with pain are not needed. X-rays are really only needed when we suspect a red flag condition. So if we're seeing red flags on the history or the examination, then x-rays should be ordered. What this means is if the doctor is seeing that there's a chance of infection, if there's been recent weight loss that's unexplainable, if there was obvious trauma, and we suspect a fracture, if there was a chance that you had a past cancer and it's now spreading, things like that are red flags and indicate that we should do imaging. Neurologic symptoms will be another one. If those are not present and we don't see any red flags, then there really is no reason to get x-rays. And actually, what taking x-rays does is it increases the amount of time that it takes to heal. This has been shown in studies that when we take x-rays of people who don't have these red flags conditions, and we show them the x-rays and we explain what's on the x-rays, that they actually take longer to heal than if they didn't have the x-rays altogether. The reason that this is because in the spine, we often find conditions like degenerative disc disease. But what degenerative disc disease actually is it's a gray hair of the spine. So we don't call gray hair of the spine degenerative hair disease. We don't call wrinkling of the skin degenerative skin disease. But that's essentially what they are in relation to degenerative disc disease. They are normal consequences of aging that happen to almost every person. And what we found is almost everyone has degenerative disc disease beyond a certain age. This is just normal and it's not associated with pain. So when we take x-rays of people who don't need x-rays and show them that they have degenerative disc disease, they believe that they have a chronic condition that's going to take longer to heal. And that's why it takes longer for those people to get better. So really, if you are going to a practitioner who wants to take x-rays on the first visit just for defensive practices or for whatever reason, you should be wary of that. X-rays are not needed unless there's red flag conditions. This has been conclusively shown in studies, and this has been agreed upon by multiple organizations, including the American Chiropractic Association.